In a montage, a cleaner washes her hands, puts on gloves, and cleans a bathroom. Title: Giving Health a Helping Hand. Environmental cleaning best practices. Bathroom cleaning. Regular patient/resident bathroom.
Please note, all scenes in this video are sample procedures based on the PIDAC environmental cleaning best practices. However, your procedures may vary according to the tools, equipment, and cleaning products being used within your facility. Also, the use of any logos and products seen in this video is not intended as an endorsement.
Note: if using two separate products for cleaning and for disinfection, repeat steps 1 to 11 with disinfectant after cleaning. Bathrooms require hospital clean, which includes a periodic monitoring auditing component done by a supervisor. Bathrooms should be cleaned last, after completing the room. Before cleaning a bathroom in a regular patient-resident room, the following procedures must take place. Gather all the materials required for cleaning before entering the room, including an adequate supply of clean cloths, fresh cleaning solution, and hospital-grade disinfectant. These materials may be combined in one product. A dust mop, a wet mop and bucket, or a microfiber mop. Clean your hands with an alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Put on gloves. Enter the bathroom and remove soiled linen from the floor and place in linen bag. Remove debris from the floor and place it in the waste receptacle. Dry any wet spots with paper towel and place in the waste receptacle. Remove gross soil, like blood and feces, prior to cleaning. Remove the waste, handling plastic bags from the top, but do not compress bags with your hands. Be alert for needles and other sharp objects, and pick up sharp items using a mechanical device. Then place into sharps container and report the incident to the supervisor. After this, remove your gloves and discard them. Clean your hands once again with alcohol-based hand rub or soap and water if your hands are visibly soiled, and put on fresh gloves. Begin the cleaning procedure by using a fresh cloth saturated with cleaning solution, disinfectant. Clean with only one cloth at a time. When finished one area, put the used cloth aside for laundering and use a fresh cloth to continue. If a bucket is used, do not double dip the cloth. Do not shake the cloths. Change the cleaning cloth when it is no longer saturated with solution and after cleaning heavily soiled areas such as the toilet. Place the soiled cloths in a designated container or a bag for laundering. Working from least soiled areas to the most soiled areas, and from high surfaces to low surfaces, use the following procedures. 1. Clean the door, door handles, push plate, and touched areas of the frame. 2. Check walls for visible soiling and clean if required. 3. Clean the light switch. 4. Clean chrome wall attachments. 5. Clean all wall-mounted dispensers and frames. 6. Check and remove fingerprints and soil from mirror with glass cleaner. 7. Clean the call bell and cord. 8. Clean support railings, ledges, and shelves. 9. Apply toilet bowl disinfectant to the toilet bowl and allow it to remain while cleaning the sink and shower tub to ensure enough contact time with the disinfectant. 10. When cleaning the sink, clean all surfaces around the sink, vanity, or countertop. Clean inside and outside of the sink, sink faucets, and the mirror. 11. Wipe plumbing under the sink. Apply disinfectant to the interior of the sink, ensuring sufficient contact time with disinfectant. Rinse the sink and fixtures and wipe dry. When cleaning the shower tub area, clean inside and outside the area. Clean faucets, walls, and railing, scrubbing as required to remove soap scum. Inspect grout for mold and apply disinfectant to interior surfaces of the shower tub, including soap dish, faucets, and shower head. Make sure that there is enough contact time for disinfectant. Rinse the shower tub and fixtures and wipe dry. Inspect and replace shower curtains monthly and as required. Finish cleaning the toilet. Clean the toilet handle. Clean all exterior surfaces of the toilet. Clean underside of the flush rim. Clean the toilet bowl and flush the toilet. Once this is done, carefully remove gloves and clean your hands with alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Replenish paper towels, toilet paper, and waste bag as required. Also, replace empty soap, lotion, and alcohol-based hand rub containers with fresh supplies as required, but do not top up liquid containers. Put on fresh gloves. When dry mopping the floor, start at the back of the room and work towards the door. You must keep the dust mop on the floor at all times once you've started, and use the swivel motion of the frame and wrist to change direction. Take your time to minimize any turbulence to prevent the dispersion of dust. Then carefully dispose of debris, being careful not to stir up dust, and do not shake the mop. When wet mopping the floor, note that disinfectant is not required for the floors. If you're using a loop mop and bucket, place a wet floor caution sign outside of room or area being mopped. Immerse the mop in cleaning solution and wring it out. Start at the back of the room and work towards the door. Push the mop around baseboards first and pay special attention to removing soil from corners without splashing the walls. Turn the mop head over every 5 or 6 strokes and rinse the mop if the area is greater than 3 meters by 3 meters or 9 feet by 9 feet. Repeat the procedure until the entire floor is done. Then remove the mop head for laundering. If you are using a microfiber mop, fill the plastic basin with cleaning solution. Place microfiber pads to soak in the basin. Take a clean pad from the basin, wring it out, and attach it to the mop head using Velcro strips. Place the wet floor caution sign outside of the room or area being mopped. Start at the back of the room and work towards the door. Remove the microfiber mop pad when soiled and when finished cleaning the room, and set aside for laundering. A new microfiber pad is used in each room. Send the soiled microfiber pads for laundering at the end of the day. Remove your gloves and clean your hands with the alcohol-based hand rub. If your hands are visibly soiled, you must use soap and water to clean them. Do not leave the room wearing soiled gloves. Gather all the cleaning materials and leave the bathroom. Additionally, for discharge and vacancy cleaning, change all waste bags, clean waste cans if they are dirty, and scrub the shower walls. After cleaning, you must report to your supervisor if there are areas that have mold or are cracked, and leaking or damaged areas that need repair. All the tools used for cleaning and disinfecting must be cleaned and dried between uses, including all mop heads and cloths. Mop heads must be laundered daily, and all washed mop heads must be dried thoroughly before reuse. Also, make sure all housekeeping carts and carts used to transport waste are cleaned thoroughly at least once a day.
Thank you to Customer Support Services, Hamilton Health Science Center for their assistance in the production of this video. Audio description by 1Extra.